Oral submucous fibrosis (OSF) is a chronic, complex, premalignant 1% transformation risk condition of the oral cavity, characterized by juxtaepithelial inflammatory reaction and progressive fibrosis of the submucosal tissues, the lamina propria, and deeper connective tissues. As the disease progresses, the oral mucosa becomes fibrotic to the point that the person is unable to open the mouth. 1-2 The condition is remotely linked to oral cancers and is associated with the chewing of areca nut and/or its byproducts, commonly practiced in South and Southeast Asian countries. 3 The incidence of OSF has also increased in Western countries due to changing habits and population migration. Symptoms. In the initial phase of the disease, the mucosa feels leathery with palpable fibrotic bands. The oral mucosa loses resiliency in the advanced stage and becomes blanched and stiff. This blanched and stiff mucosa is considered to lead to a progressive reduction in mouth opening but seems to be an oversimplification of the pathology. The degree of mouth opening is also determined by the severity of oral symptoms, such as recurring or persistent glossitis and stomatitis, a fact that many researchers ignore. This phenomenon is explained by the term reflectory trismus, where the above symptoms dictate the degree of mouth opening through activation of the 5th and 9th cranial nerves. However, muscle damage and fibrosis play a larger contributory role. 10 The condition is believed to begin in the posterior part of the oral cavity and gradually spread outward. The premise posterior to the anterior progression of oral submucous fibrosis has been recently rebutted based on several reports stating that the disease may be restricted to the anterior part of the oral cavity without involvement of posterior parts. The sites are dictated by the manner of use: anterior areas of the oral cavity when spitting and posterior when swallowed. 11. Other features of the disease include xerostomia, recurrent ulceration, pain in the ear or deafness, nasal intonation of voice, restriction of the movement of the soft palate, a bud-like shrunken uvula, thinning and stiffening of the lips, pigmentation of the oral mucosa, dryness of the mouth and burning sensation, stomatopurosis, decreased tongue protrusion. Cause. Dried products such as pan masala and gutka have higher concentrations of areca nut and appear to cause the disease. Areca nut is the definitive causative agent of OSF. A new term was introduced by Sharma et al. In 2024, areca nut-induced oral fibrosis (AIOF), since fibrosis in the oral cavity can occur due to various causes and thus have varying malignant propensity. The reclassification of OSF as AIOF has significant implications for diagnosis and management. It emphasizes the primary causative agent and its role in developing the condition. This reclassification improves diagnosis, management, and patient education. Recognizing AIOF as a distinct entity also enhances understanding, enables researchers to explore prevention strategies, and equips policymakers to implement targeted public health campaigns. 8. Fibrosis due to other causes has distinctive features and should be named according to cause and not called oral submucous fibrosis. Treatment. IFN-gamma is an antifibrotic cytokine which alters collagen synthesis and helps in OSF. Colchicine tablets 0.5 mg twice a day 32. Lycopene, 16 mg a day helps in improvement of OSF. The treatment of patients with oral submucous fibrosis depends on the degree of clinical involvement. If the disease is detected at a very early stage, cessation of the habit is sufficient. Most patients with oral submucous fibrosis present with moderate to severe disease. Severe oral submucous fibrosis is irreversible. Moderate oral submucous fibrosis is reversible with cessation of habit and mouth opening exercise. Current modern-day medical treatments can make the mouth opening to normal minimum levels of 30 mm mouth opening with proper treatment.